Welcome to today's episode, which is the first in a series launched by the European Society for Traumatic Stress Studies, ESTSS Future Leadership Group. I'm Stephanie, a PhD student in psychiatry at the Amsterdam University Medical Center, senior consultant in public health policy, and a member of ESTSS's Future Leadership Group. The FLG, or Future Leadership Group, is a community of young psychotraumatology professionals and researchers representing currently 8 countries in the European region. During these monthly podcast episodes, you'll have the opportunity to meet different members of ESTSS's FLG group who will take turns hosting the different podcast sessions. We'll discuss the latest advances, challenges, and future directions in understanding and addressing psychological trauma across Europe and beyond. We'll also explore different types of themes in the psychotraumatology field through conversations with both European and international experts. So whether you're a clinician, a researcher, student policymaker, or program implementer, or if you're just someone really interested in learning more about psychotraumatology, we hope that you'll enjoy this series. So joining us for today's launch episode are 3 distinguished guests who not only possess deep expertise in traumatic stress studies, but also serve as ESTSS board members. Today, we have the pleasure of welcoming Professor Dominic Murphy, who is consultant clinical psychologist, co-director of and professor at the King's Centre for Military Health Research at King's College London in the United Kingdom, and head of research at the Combat Stress Centre for Applied Military Health Research. He is currently ESTSS president, having previously served as ESTSS treasurer and as a board member, former president of the UK Psychological Trauma Society, and is widely published within the field of psychological trauma. Today, we're also lucky to have with us Dr. Joanne Mouthaan, a psychologist and associate professor in the Department of Clinical Psychology at Leiden University in the Netherlands. Joanne is the past president and treasurer of ESTSS and former president of the Dutch Language Psychotrauma Association, NTVP. And last, but certainly not least, we are very excited to also have with us Dr. Maria Bragesjö, who is a licensed psychologist and psychotherapist, as well as a postdoctoral researcher at the Center for Psychiatry Research in the Department of Clinical Neuroscience at the Karolinska Institute in Sweden. Maria also serves as vice president of the Swedish Society for Traumatic Stress Studies and as psychological manager at the trauma program at Psychiatry Sydväst in Sweden, where she is supporting the development of regional PTSD centers of excellence. Dominic, Joanne, and Maria, welcome. It's a pleasure to have you here today as our first guests on this podcast.
Thank you so much for inviting us.
Pleasure to have you. So to start us off, and for our listeners and viewers to get to know you a little bit better, I'd like to begin with a bit of a personal question. I hope you don't mind. So I'm curious, what was your most peculiar or bad habit that you had as a PhD student? And have you carried this over into your professional life and your professional routine, or is this something that was very specific to your time as a doctoral student? So maybe we can start with you, Joanne, and then we can hear from you, Dominic and Maria.
Thank you for letting me start, because I had, maybe you saw in my face that I already had something in mind. I think a combination of like procrastination and finding everything interesting. So I sometimes had some fears of starting something new, or what I would think would be difficult, and then my eye would wander to other, more like side things, or a little bit outside of the focus of my research, and I would rather go into that. And I think, unfortunately or fortunately, that's something that's just a fit for me. So I also have many different types of interests and research projects, and maybe I procrastinate a little less. That's something that I learned. But yeah, those are the things, I think.
Thanks. I think many people can relate to that. So going down rabbit holes. Yeah. What about you, Dominique?
Well, I did my PhD. I started a long time ago. We still used to print off everything. And one of my worst habits was I never threw anything away. So I can remember when I finished my PhD, my desk was maybe 20, 30 centimeters deep in just research papers and stuff, because it got to a stage where I couldn't, there was no way back. So I remember putting it all into a massive black bag and throwing it all away. Now I wish I could say that's left me, but there've been times in my life I've also done that. Did it once and accidentally threw away a work credit card that was buried within that pile as well. So learn to be more organized is one thing I suggest.
Thanks for sharing. That's quite funny. What about you, Maria?
I think I had a really hard time saying no to things. I said yes to everything because I wanted to learn so much, and I wanted to, collaborate with everybody, different professors or postdocs or other PhD students. And I mean, there's so much interesting stuff to learn and so much fun things to be part of. So I think that's really something that I've been working with, since I did my PhD, saying no to things. And because my brain works in that way. I like to have many things going on at the same time because otherwise I'm getting bored. But it's a fine kind of also balance, because if you say yes to everything, you have so much to do and you do everything kind of halfway. So yeah, I think that's one thing that I'm still struggling with in a way, because my brain works actually that way.
Yeah, I think it's a bit the curse of having a curious brain in a way.
Yeah.
Yeah. Thank you so much for sharing that, all three of you. So now for those who are listening to us and for our viewers who may not be completely familiar with ESTSS, could you perhaps start off by saying a few words about the society, including what it is, who it is for, and how it might be of value to those listening to us? So as president of ESTSS, Dominic, perhaps you can start, and then we can go to Maria and Joanne.
Well, I don't want to steal everyone's thunder, so I'd say a little bit, and I'll leave. But the way I think of the ESTSS is an umbrella organization, brings together societies from different European countries. That helps us really focus on improving the health and well-being of those affected by psychological trauma. And, more than that, for me, it feels like, because it's working with people with shared values, it does feel like a family working across Europe. And I think that's kind of one of the key things about raising kind of standards, bringing evidence, and connecting people. I'll hand over to Joanne or Maria, who wants to add to that.
Yeah, I would definitely echo that. I think a lot about ESTSS as like a professional home in a sense. So, I mean, there's both kind of more clinicians, researchers. I mean, everybody involved in some type of helping people who has been exposed to different things is welcome. So I really see that like a family in a sense. So, yeah.
Yeah, good. I think we're all on the same page when it comes to that like community sense. And I think it's also important maybe to bring in a little bit of the history. So ESTSS really came about from a desire to get organized and to connect research and prevention and clinical care and also policy making, like in the whole field of psychotraumatology. And not just internationally, like crossing borders, but also locally. Because in many places, there's not much like local, an existing local system, where people can really get trauma care. And that is something that individual professionals already recognized. So they sought each other out. They found each other at conferences of maybe bigger mental health or psychiatry societies. And that is actually where the ESTSS started from, like individuals finding each other on the topic of psychotraumatology. So I think it's always funny to realize also when we have our own conferences, seeing people really connect there and getting to know each other. That's also where everything started. So we almost take it for granted now that we have these societies for traumatic stress studies, right? We have them locally, we have them at continental levels, even at a global level. But it's not that long ago that this started from professionals recognizing the importance of the topic and finding each other, at these places where you can connect. So that is, I think, for me, the main thriving factor for ESTSS. Is the connections and the sense of community.
Yeah, thank you so much. It's very interesting to hear about the history of the society as well, and that it sort of came about in a quite organic way and determined by individuals who are really seeking one another out. And it's really lovely to hear you all describe it as a professional home and family. I think that speaks really to the quality of the network. So let me ask you then, why do you think those working in the field of psychotraumatology should join the society? What are the benefits to being part of this type of society? Maybe we can start with you, Dominic. Sure.
Okay. Well, I think to build upon what Joanne and Maria were saying, the ESTS really is an opportunity to bring like-minded people together. And the value in that is really, it's about exchange of knowledge and expertise. And, like life more generally, working in partnership is always more fun, more advantageous than working alone, particularly when we're in a world with, resource is finite, and actually getting the biggest bang for your buck is often about working in partnerships and exchanging knowledge. And I think that's one of the key things. The other thing is, we are a very friendly bunch. I think there's a really strong balance if you come to our conferences between research, clinical, and having fun and connecting and building collaborations and partnerships. What's really important for me is that we're not a business. Rather, we're a grouping of volunteer organizations, which generally I think means that the members all share, similar values and similar sense of humor, but also that similar commitment to improving the lives and well-being of those sadly affected by psychological trauma. And there is also something quite unique about us, which is we're multidisciplinary. We're not tied to one discipline, which isn't always the case in some of the other societies.
Thank you, Joanne. Maria, do you have anything you'd like to add?
Well, you're like cutting the grass in front of our feet. I'm not sure if that's an English expression, but it is in Dutch. No, I think you said it all, Dominic, because to me, one of the main values of being in a society is these interconnections that we have, right? So there's also no growth in a vacuum. Your ideas and knowledge and even skills can only develop if you share them, if you test them with your peers, if you also build upon what others have been doing, if you can learn from them. So, and it's the same with your personal development. So if you, if you want to develop further in whatever field you want, I think it's very, useful also to find your society and then especially if you're interested in trauma, our society, because we're so friendly.
Yeah, I mean, you said it all. I mean, what can I add? I think that, we have also good member benefits. I mean, we get emails about upcoming trainings, and we have these great conferences. We get a discount on the great ESTSS conference that's it's biannually. So we also you also get some easy access to knowledge within the field. So yeah, so that's sort of can I add, but you said it all.
Thank you so much. So clearly there are a lot of multiple different types of benefits to being part of the society. So I'm curious, what motivated each of you to join ESTSS Board, and how has this experience contributed to your professional journey? So maybe we can start with you, Maria, and then go to Joanne and then Dominic.
I think for me, I joined because I wanted to find that type of family that I see in the ESTS, and learning from other people in the field that are really like-minded in a sense, and also contribute myself and discuss different things that I'm doing in Sweden with other Europeans. I think that has been so valuable. So it's really kind of getting a network where you grow, when you learn from each other. And I think that was kind of my motivation. And I also feel that ESTS is like a place, and the board is a good place where that kind of really matters. So being able to contribute and also learning from others. So I think that was kind of the main thing.
Yeah, good. Yeah. Well, in the ESTSS, we have the structure that we have societies as the members, and every society has their representative. So I joined ESTSS as a representative to the Dutch Language Society, Psychotrauma Association. So I already had some expertise or some experience in the Dutch board. So maybe it's useful. Why did I join the Dutch board? But that's because I had that strong sense of I want to connect to really learn more about the topic of psychotraumatology and to share and exchange ideas with other people. And that got me, involved in the local society, ultimately also as a board member, but first just as an active member. And there's usually so many, things that you can apply for. You don't need to go to be a board member per se at first, right? You can join a committee, for instance, or you can do a book review maybe, for the local newsletter. So there's also like these types of activities that you can do. And I think that's a really easy and nice way to see if this is a society that fits you and what you can do more.
I think in a similar way to Maria and Joanne, it was my involvement with my local society, the UK, my political performance society first, and then the ESTSS second, that kind of got me into it. And I'm just thinking about what I can add to that answer. For me, I guess it was about sometimes you can get lost in the details of work. You can get lost both clinically or in research, and actually being part of a wider society like the ESTSS kind of helps me kind of take a step back, helps me kind of reflect more about what I'm doing, how it fits in the wider context, and kind of how I can work with other people. So for me, it's a really valuable space to also just be able to kind of zoom back a bit, because sometimes work is so busy day to day. So I think that's the other huge value of these societies.
Yeah, thank you for all three of you. I think that's interesting that it fosters this ability to take a bit of distance and step back and see the broader picture and be able to reflect on that. And thank you also, Maria and Joanne, also for highlighting, the different opportunities that exist in terms of getting involved with national societies, but also at the European level, that it's not just being on the board, but that there are many other ways that one can contribute. I think that's really, really valuable for those listening us to hear about. So from your perspective, what advice would you give to professionals, particularly young professionals, but maybe also not so young professionals who are interested in either joining a board, whether it's at a national level or at the European level, or simply becoming more involved with ESTSS? So you gave some examples of how it is possible to become more involved, but I'm curious to hear about what type of advice you would have for those interested in doing so. So maybe we can start with you, Joanne.
Good. But I have to think about it a little bit. Is that okay?
That's okay.
Maybe Dominic or Maria already has something in mind.
Okay, yeah, I can start. Yeah. Okay, I think my advice is don't wait until you feel like senior enough. I mean, I think that sometimes when you want to get involved in things, you think that you have to be an expert before you join in things. I mean, it's a learning process and you learn a lot kind of when you are joining. So I think for me, for example, I joined the Swedish local society, the National Society, as a more kind of novice in my career, and I joined the Swedish board and became a vice president of that as a PhD student. So, I mean, you don't have to be like really senior to start getting involved. I mean, you can also start with small things. You don't have to start with joining the board. I mean, you can get involved in committees or special interest groups, or you can present something on the conference or just join the conference. Or, I mean, start small and kind of build on that, I think. But I think my biggest advice is don't wait until you feel senior. I mean, start when, early. Yeah.
Dominic, yeah, please go ahead.
Well, Joanne, are you ready to? Oh, I guess I'll just build on that really, is I can understand that it can sometimes feel intimidating being on a board and you think everyone's an expert and they all know each other. But just remember that everyone just go for it really. People are friendly, they are welcoming. That's the great thing about, I think, working in our field. and actually try to get involved through your local society first, or maybe also looking out for the fantastic opportunities like the future leadership group opportunities that the ESTSS offer. I think the other thing I always found is the ESTSS friendly, welcoming, all that sort of stuff. It's really helpful to go with a curious kind of mindset and that kind of what can I do to help attitude rather than what can this do for me? Because I think you'll get lots out of it if you go in with a kind of what you can do to help. But, that sort of positive framework will be helpful.
Yeah. Okay. Thanks. Yeah. Now I have a little bit more. Yeah. So there could be loads of types of advices, and I agree with both of them. So from Maria and Dominic. But I was also triggered by what you said, Stephanie, about maybe the not so young or the not so early career folks out there. Because we all know that's the more senior, the more different types of roles and responsibilities, also the fuller your schedule is. But there's still also like small things that you can do to lend your expertise. So for instance, take on an advisory role in a committee, for instance, that's so valuable. Especially also for the young professionals who tend to, also, or we can use the network for also getting better connected and to learning from people in more senior positions. And everyone has talents. Doesn't have to be, specifically on the content or the state of the art of science. If you're very good at organizing, for instance, or if you're very good at writing like small popular pieces, or if you're good at convincing sponsors to sponsor part of the program or something, that's also very useful for society. So that echoes, I think, what Dominic says, right? So just stay curious and see how you can contribute, because it could be in ways that you wouldn't expect before.
Thank you so much, the three of you. I think you've shared some really valuable advice to come in with an open mind and stay curious, that there are many different roles that one can contribute to based on one's skills and knowledge, and that you can start small. You don't right away have to go for the biggest role, and also to not necessarily wait until you perceive that you're an expert. So I think that's very valuable. Thank you so much to all three of you for those responses. So now I would like to dive a little bit deeper into your own professional trajectories and experiences. And I'm curious to hear, what are some of the, let's say, pivotal moments or turning points in your career that got you to where you are now? Perhaps you can each first start with a very brief overview for our listeners of your professional path and background, and then answer that question. I'll give you a moment to reflect, and whoever wants to start first, please go ahead. Dominic, you seem keen.
I was waiting to see if anyone was going to put the hand up. So that's one of my problems. When there's a silence, I always think, I need to go and help. Very briefly, I actually left university with an undergraduate in psychology. Didn't really want to do psychology. I didn't really like psychology because it wasn't really about mental health, right? For whatever reason. And then I got a job as a research assistant on a big project that was looking at the health and well-being of the people involved in the 2003 Iraq invasion, military soldiers. And it felt relevant, it felt applied, and it felt like it was actually helping people. So I really enjoyed that. I did a PhD within that department. And then I felt a little like I wanted to be more involved. So in the UK, a PhD doesn't allow you to practice clinically. So I did another doctorate, but this time a doctorate in clinical psychology, which allowed me to do that. And I kind of, I think that the importance I've had in my career is about the mentors I've met along the way. My fantastic PhD supervisor, who's now a very close friend, people that then also was my supervisor in other ways in my doctorate in clinical psychology. And I think I can't underestimate the importance of strong mentors. And I think that was really important.
Maria, do you want to go first, or?
Yeah, sure. Okay, so I'm a clinical psychologist and a researcher, and I work as a psychology manager at the Center for Excellence for PTSD in Stockholm, where I live. And I'm also a trainer in prolonged exposure, which is one of the evidence-based treatment for PTSD. And my research kind of involves on doing research on different treatment formats using prolonged exposure, for example, digital interventions or intensive treatment, and also getting the treatment out there kind of more implementation-wise. And so that's what I'm doing right now. And I think I would go back to actually 97, where that kind of got me where I am now. And that was when I started to become a psychologist. So in Sweden, you have your first clinical encounter with a patient at your 7th semester. So at the 7th semester in the psychology program, I met my first PTSD patient, actually. And my supervisor said that it was unethical for a student to treat a PTSD case. She said that PTSD patients were very hard to treat, and that it should probably take a long time as well, because we only had 2 semesters to finish the treatment. So she said I wouldn't finish in time. And she was quite upset, actually. So I heard a lot of things about PTSD patients, actually. So that actually scared me. I mean, I was at my 7th semester, and that was my first patient. So I was actually quite anxious. So, but then I went to the library. That was kind of what I did when I was a student. I didn't know anything, so I went to the library. And then I said, okay, I need to know everything about how to treat PTSD. And I did it yesterday, kind of. And then I found Edna Foa's Treating the Trauma of Rape, which just recently was published. And that is kind of what actually became the PE manual later, but that was kind of the first more book that you could follow to do the treatment. So I read that. But then I was kind of also anxious in other ways, because I didn't have like a rape victim that I was treating. I was treating somebody who had been through war instead, war experiences. And then I was kind of, can I use the same techniques with somebody who's been through war, with somebody that has been through a rape? So I was kind of, I was so stressed out. I couldn't sleep, actually, before I met this patient. But then I met this patient, and I mean, she was really sweet, of course. I mean, she wasn't that, monster that I had in my head, and she really needed help. So I tried as best as I could to follow what Edna Foa was writing in her book. And then after like 8 or 10 sessions, she said, I don't need you anymore. I mean, I don't have a PTSD, I don't think. I mean, I can work again. I can walk the streets. I can do what I want. So, and then I actually was more stressed because I didn't want to go to my supervisor and said that we were finishing up in this week, because she said that this treatment should be really long, not like 8 or 10 sessions. So I made the patient actually come for a few more sessions to, do a thorough assessment at the end. But my assessment was that she didn't fulfill the diagnosis of PTSD anymore, although she had problems for 20 years when I saw her. So, and I think that was kind of the eye-opening for me, I think, starting to look into the PTSD field, because I felt that there were so many kind of ideas on treatment and who should get treatment. And I realized that many therapists were also scared of treating PTSD. So that really kind of got me going when I finished up my psychology program. So I really felt that I wanted to work somewhere where I could treat PTSD. And what I noticed was that was everywhere. And I saw that in the clinicians also when I started working in psychiatry in Sweden. I did my kind of the 1 year before I got my license. And everywhere I went, I kind of met this kind of ideas on how difficult it was to treat. And I saw that many clinicians also hesitated into using exposure-based techniques back then. So that kind of got me started. I started to read a lot. I did trainings with Edna eventually, Edna for a while, the mother of the treatment techniques or the method. And then I just continued kind of trying to increase accessibility to those types of treatment in Sweden. So yeah, maybe a long story, but yeah, that's what you asked.
This is so nice because, you know, we've known each other for some time now, Dominic, Maria, and I. So, and these are things that we it's new to us as well. So it's really nice to hear. But the question was, Stéfanie, again.
Yeah, of course. It was asking about what were some of the pivotal moments or turning points in your career that got you to where you are now, and maybe just to start to give a bit of background about your professional path and background.
Yeah. I think it's also quite funny if you have to think back on how things are going, and now it seems quite logical maybe where you are. You know, but the road up to it, it's also kind of, you know, lucky turns, right? Sometimes there's a road that doesn't go any further, you know, you need to take like a side road or something, and then that ultimately leads you to where you are. Otherwise, you wouldn't be here. And in my case, I didn't start out studying psychology for psychology. I wanted to do communication science, but then I did find out during my bachelor's that psychology was kind of neat. So I just stuck with it, I guess. And then I couldn't choose again, you know, I see that as a kind of a red thread throughout. So I actually did 2 masters. So one was more into health and well-being, and the other one was health and well-being in organizational context, and the other one was clinical psychology. And I had to find like a final thesis topic, and I wanted to combine both. So that got me to the Veterans Institute in the Netherlands, where both the organizational context, but also the clinical psychology side, it kind of merged. But then again, that was also kind of a lucky draw because I thought I wanted to do something with people in risky professions. And then there was like a professor in the department who had connections to the military. If he had connections to the firefighters or to train conductors or something, you know, it could have gone a different way, but this was the military. So at first I did my thesis there on the needs and wishes of United Nations veterans. And then I was lucky enough to get my first job there. So my first job was a researcher. So I didn't go the clinical route, also because I really liked doing research. And it was a very welcoming environment because this was a group of people who hadn't really had that kind of attention yet, you know, for the mental health side of things. So the news coverage around these people was usually very negative. You know, there were all these excesses, they were homeless, they were causing trouble, all those types of things, or they just wanted to have like more of a military pension. You know, there was all like this negative news around it. And now there was someone, or at least some project, really interested in hearing their side. So it was really a welcoming startup point as a researcher, and also to get more of an insight into what does it mean if people live with traumatic memories for such a long time, because these people had experienced something 25 years ago, you know, but they also like got back into society and other things happen along the way. So it evolves, you know, it's not static. It evolves, it gets new meanings. So it was fascinating also to be part of that and to get such an inside look into what it means for them. But at the same time, I was also curious, but what happens in the immediate aftermath of trauma, right? So now we're at a certain time point where whole people's identities could have been formed through something that they've experienced 25 years ago. But what happens in the immediate time after that? So I started my PhD research, which was into traumatic injury victims, following them up in the emergency department up to 1 year after their accidents. So an ambulance chaser kind of setup, if you can say that. And that also gave me so much more insight into what does it mean, how people can also develop and function again normally. You know, what is the personal resilience of people, and how can you further support that? And you know, that got me really interested in those mechanisms, and also how we can work towards offering people skills or resources that they can use to, you know, build that resilience. And how can we like innovate our preventive or even curative interventions? Yeah, and if I think about where I am now, I'm mainly an educator. I'm someone who focuses on improving our clinical education. It seems like a big step, but it's also not, because it's all about how can we get more insight into all of those mechanisms, right? That ultimately lead people to be able to recover or to find meaning. And how can we strengthen those as clinicians? And how can we make sure, you know, at universities or at training programs that we train our caregivers in ways to, you know, further support people who've gone through difficult circumstances. Yeah, but if you ask what are pivotal moments or crucial things, you know, sometimes things just come into your path and you try something out, and then you like it or you don't like it. And then sometimes the people who are in your path are a big help or a big influence. And I think I've, just like Dominic, also had some very, very, helpful people along the way. And those also, you know, come sometimes from societies just like this. At least it could give you like access to people who you can learn from. You can learn whether something is for you or it's not for you. So it can help you either way.
Thank you so much. It's really insightful to hear from all three of you. And I think you all spoke a little bit to the fluidity of one's professional paths, and that it's sort of constantly changing and evolving and, you know, shifting as you go along between different roles as researcher, clinician, as an educator. That's really interesting. And I think you also touched on a few points that were really quite insightful in terms of the importance of mentors and people who can open doors, but also the importance of challenging experiences where you're being challenged by someone who might be more senior to you, and that sort of motivates you to go and learn more and to get more hands-on experience in that area. So I think that's really insightful. As well as also you spoke all about challenging the status quo a little bit, both in terms of the research field, but what might be some preconceived notions within the field, and also maybe expectations that you had for yourself. So thank you so much for sharing that. So now I would like us to look a little bit into the future. And as researchers, clinicians, and members of the ESTSS board, what important gaps or areas do you think we should be focusing on as a psychotraumatology community, particularly considering how rapidly shifting the geopolitical context is in the European continent, as well as all the different technologically driven developments that we're seeing? Dominic, please go ahead.
So, I guess I'm going to split it across three levels. First, as an individual level, I think there's a lot of opportunities to improve treatments at the moment with the new developments in the relatively new diagnosis of complex PTSD, opening up an opportunity to think more broadly about how to improve treatments. I'm doing a lot of work in complex PTSD, but also moral injury, kind of as an emerging field. I think individual treatments, lots of potential for growth and improvement. At a system level, you know, there's a reality that there's a lot of pressures facing our healthcare system. I think that's true across Europe and more broadly. And I do think it's really important to maybe shift our attention a little bit to how we support the healthcare staff. We have some great treatments, but we also need to make sure that we care for the caring. And then more broadly on a kind of society level, I think there's a huge progress in understanding around mental health and in particular around PTSD. But I think a lot more could be done, particularly in the areas like Joanne started talking about around prevention, but then also response after terrible events. And then, as I kind of tied to kind of ideas of treatment, often we're still rooting a lot of responses into the individual. And I think actually sometimes community-based responses and preventive responses could be really helpful.
And if I can add to that, I totally agree with all of the points Dominic makes. That it's also about accessibility, right? So it's improving accessibility to a wide range of people who have difficulty gaining access now, and that can be different in different local circumstances. So not even on the country level, but even more on a regional level. And I think sharing our experiences with that, with testing out different systems is very, it makes sense. And I think one thing that we try to do is also is through the TENS network, which is the European Network on Traumatic Stress Studies, is also share our experiences when it comes to large-scale incidents and disasters, for instance, just also because of all of these local different circumstances where there's still maybe something that's possible to generalize, like the difficulty in gaining access for people with special needs, for instance. But at the same time, it's not just improving access to evidence-based treatments or to support systems, but also access to education and training for the caregivers, or even for staff that are not specifically psychologically or medically trained, but who still play an important part within the whole chain of services for people who are affected by trauma. So I think we've just scaled the service up till now when it comes to that. I think most research, especially from larger institutions who give grants, go into researching evidence-based treatments or researching how to optimize treatments. But I think we can maybe also be a little bit more of a, how do you say that? Now I don't know the word, but an advocate for towards these grant providers or financial support systems to also think about and how do we implement these in a way that it really improves accessibility for people.
Yeah, I totally agree with both Joanne and Dominic. So I think access to evidence-based care is still the big one, kind of especially for vulnerable populations. And of course, at the same time, we're seeing really rapid developments in digital treatments and new treatment formats. And we need to integrate those kind of in a responsible way. And also with the current political situation, both in Europe and in the world, trauma-informed responses are more important than ever, I think, not just in clinics, but also on a societal level. And I really hope for the ESTSS for kind of the upcoming future to kind of continue to be this strong, credible voice in Europe and keep strengthening collaboration across countries and professionals.
Thank you so much. I think those are very insightful responses. We're unfortunately nearing the end of our time together today. But before we go in the last few minutes, I would like to very briefly hear from each of you. What would you like to see ESTSS and its members accomplish over the next 2 years? So perhaps you can each say 2 to 3 priorities very briefly. Dominic, would you like to start? You seem keen.
Well, I do think that, one of the key outputs of the ESTSS is our conference. And our next conference is in 2027 in Portugal and Coimbra. And I think actually, for me, that's a key place for the dissemination of best practice and to build these collaborations. That's one thing I'm really looking forward to seeing come to fruition. I think, the ESTSS is growing, and we're going to be welcoming in 3 new societies, in France, Greece, and Bulgaria, which is fantastic. And actually and also to build upon the fantastic work that the Future Leadership Group is doing, yourselves and all the other members, bring new people into our society to keep it vibrant.
Thank you. Maria, would you like to go next?
Yeah, I can only echo, I think, what Dominic said. I'm really looking forward to the Portugal conference, and that, both meeting people and getting updated on different things. So, and maybe present something myself, I don't know. And also kind of see what happens now when we have a few more societies joining. And that's also always so interesting when you get new input from different countries, different systems. So that is also something I'm looking forward to.
Thank you. What about you, Joanne?
Yeah, to add to that, I think, and this is something that we always strive for this, but I think what we can do, or I hope that we can accomplish, or the members can, is just to stay connected also on topics that we need to, raise discussion over. So yeah, that's something that I look forward to continuing, and even also maybe making it a little bit bigger within the society, that we have those opportunities to also discuss things that might not be self-evident, or that also maybe might be a little bit difficult to discuss.
Thank you so much. So lots to look forward to, new societies in France, Greece, and Bulgaria, the conference in 2027, bringing in and connecting with new people and new ideas. And also raising awareness and making sure that we discuss topics that might be challenging. Thank you. I think you've given our listeners a lot to think about and to digest. So thank you so much to the 3 of you, Maria, Joanne, and Dominic, for joining us today for ESTSS Future Leadership Group's launch episode. It's been a true pleasure to have the 3 of you here today. So thank you again so much for a very insightful and interesting conversation.
Thank you, Stephanie, and also the rest of the Future Leadership Group.
Thank you. Yeah, enjoy the rest of your day.
Thank you.
And thank you to our listeners and viewers. Do stay tuned for more monthly episodes produced by ESTSS Future Leadership Group, where we will continue to host experts in the psychotraumatology field for insightful conversations that bridge research, clinical practice, and international collaboration. Don't forget to check out ESTSS's website at estss.org, and do register as a member and follow us on social media. You can find us on Blue Sky using the handle at estss.bsky.social, or on LinkedIn by searching for the European Society for Traumatic Stress Studies. Thank you again to our guests and to all of you for joining today's episode.